My name is Praveen. I'm the practical nursing student in Seneca College. So I will be demonstrating the wound assessment and how to set up a sterile field. Okay, let's come over here. Hi, how are you? My name is Praveen. I will be your nurse for today. I'm a nurse student here. How are you doing today? Are you doing okay? Can I just have your name and date of birth just for the confirmations? Yeah, I can see it's fine. Yeah, just for the privacy, I'm gonna close the curtains here. Okay. Yeah. Are you okay if I do the wound care just for your consent? You said okay. I'm just gonna make sure you have the bed at your appropriate height. Okay, for me and to you as well. So, okay. Before I start any procedure, are you feeling any pain, comfort, any urge to use the washroom? No? Okay, that's good. Okay, before I start the procedure, I will just do my hand hygiene first, okay? And then I'll put my gloves on. Okay. Okay, I'm gonna put my gloves on. Okay. So now I'll go to the patient. So now I have my gloves on. Now I'm gonna go and assess the wound. So I'm gonna remove the dressing. Then we'll see what are the condition of the wound. Okay. So as you can see, there is a drainage of the blood. So there's a drainage from the wound. That will be our assessment as well. So we're gonna leave it here. Okay.
So John Doe.
So as you can see, there's redness on the surroundings of the wound. Okay. There is a swelling a bit on the edges of the wound here, and I don't see any bruises. And there is a drainage, as you can see in the dressings. And for approximations, I don't see a much approximation because the wound is still wide open. Okay, that's our assessment. And now I'm gonna check the wound's diameters, like how long or how width it is. So we're gonna use the scale to assess the length and width of the wound. Okay, so for the length, I'm gonna use the max edge, like the longest edge, to the end of this. So from here, okay, so it's, as you can see in the camera, and it's almost 13.4, so 13.4 centimeters of the length. And now let's do the width. So you have to take the longest width, like the longest distance you have for the width. So that will be like around 2.8 centimeters. Okay. Now we need to access the depth of the wound. So we will use the wooden tip to access the depth. So let's just open it for now. Okay, so that we have the wound, woolen tip. So we're gonna put it on onto the wound under, so to check the width, the depth. And along with that, we will see any tunneling or underlying in it. I don't see any tunneling or underlying of the wound, so just measure the depth. So this is what we got for the depth, and here we will measure the wound. So depth is almost 3 centimeters. So that's our assessment for the wound. Okay. Now that we have assessed the wound, and I put back the bed.
I'm gonna set it to between 75.
I check the railings as well for the safety of the patients. Okay, and now we will be I will discard this used gloves, and we will proceed to sterile field setup. Okay. gonna do the hand hygiene.
So 75 and 100.
So this is our sterile field. We have the equipment what we need for the sterile field. Okay, I'm just gonna turn this a bit so you guys can see. Okay, so before I start this, I need to clean my setting area. So I'm gonna remove the equipments over here.
I'm just talking because he's unconscious. So I'm going to use the person to check his mouth.
So I'm gonna wipe up my sterile field, just lifting up to my height. Okay, just clean this, clean. Okay. Okay, now that I have cleaned it, I will also have to clean this table as well. So we will do when we have to put the gloves on. Okay. For now, I'm going to do the hand hygiene. Okay, so I have cleaned my hand by hand hygiene. Now I will use this thing to set up my sterile field.
Do the right upper. So you in the solution. I'm gonna make sure it's like properly drained, like I'm gonna press it against properly.
Just making sure I have cleaned it again. Okay, so this is my package to install the sterile field. We're gonna open it. Making sure I'm not touching anything under 2.5 centimeters. So this is like the top fold. This is the side folds. Okay. So now that I have the forceps, I'm going to use forceps to touch any sterile field. Okay.
I'm going to go on the next side now. To the left side. That's upper quadrant.
Okay. Let's set it up a bit.
Take this guard.
Okay. Fix this.
And then
okay.
Left lower quadrant.
Take make sure you're not touching anything. Sterile field. Just have this here. Now we have to leave this above part is sterile and this is sanitized. So we have to maintain the sterility here. We'll keep it inside the 2.5 centimeter here. Okay.
So each one of those, it's good and it's properly cleaned.
Okay. Now that we have to open the gauze. Okay. So let's open it.
I use it between the right and the left, like so that you can keep his mouth open from closing. Now I'm gonna do the top.
Make sure we are not touching it and using the sterile steps to use the gauze in it here. Okay, putting it back in here. This is like garbage.
Check the client.
Okay, now we have to put some solution in here. This is palm facing the name, so you don't drain anything in here. Open it. Okay, we have the fluid in here. Now that we have the sterile field ready here, we're gonna put the gloves on, which have to be sterile as well. So this is our sterile gloves. Okay. Now let me put on the gloves here. Okay, let's open the gloves here.
I'm gonna need help. Excuse me.
Okay.
Sorry. I'm gonna move the plant from
Okay. Now let's put on the gloves. So we can touch the inner side of the gloves. So we'll put the right hand first, our dominant hand in here. Make sure you're not touching any outer side of the gloves.
Don't put it inside the bag. Yeah, there you go.
Okay, you're not touch any outer side of the gloves. Now we can use this hand to help to put on the other gloves on. So you can use the outer side because this both are sterile. So use this and put the gloves on here. Okay. Now you have this, so you can discard this, your garbage, by using the sterile field inside and your gloves. So you can use this and discard this. Okay, that's it for your sterile field. Okay, and I made sure, like I have put the bed down already before coming to sterile field, and the patient safety is fine, and that's it. Thank you.